Your doctor just gave you amlodipine. It could be for blood pressure. It could be for chest pain. You might be thinking, what is this pill going to do to my body? I think that is a question. Most people get this prescription, go home without really understanding what it does. Today, I want to explain it to you. I will tell you what amlodipine is. I will tell you how it works. I will tell you what side effects are okay and what side effects are not okay. I will tell you which other medicines and foods can cause problems with amlodipine. I will tell you about one big mistake that a lot of seniors make when they take amlodipine. Please keep watching this video until the end, because knowing about that one mistake could really help you. Amlodipine is a type of medication called calcium channel blockers. Now, before you start to feel confused by the terms, let me explain it in a simple way. The tiny muscle fibers that surround your blood vessels need calcium to get tighter. When these muscles get too tight, your blood pressure goes up. Your heart has to work too hard. Amlodipine works by blocking the way that calcium gets into these muscle cells. With calcium, the muscles relax and the blood vessels get wider and your blood pressure goes down. It is really that simple. Amlodipine also helps with something called angina, which is chest pain that happens when the heart does not get enough blood. By making the arteries wider, amlodipine lets more blood get to the heart muscle. So you feel less pain when you're doing things. Amlodipine usually comes in tablets that are 2.5, 5, and 10 milligrams. And you take one tablet every day. What I like about amlodipine is that it lasts a time in your body. This means it works slowly and steadily for 24 hours without any ups and downs. For people, this steady and predictable effect is a big advantage. When I start a patient on amlodipine, I always say to them, give amlodipine 2 to 4 weeks. That is how long it takes to see the effect of amlodipine on blood pressure. Do not worry if your blood pressure numbers do not go down in the few days. Now, what are the common side effects of amlodipine? The one I hear about the most is swelling in the ankles and feet. This happens because when the blood vessels get bigger and a small amount of moves into the surrounding tissue. It is not dangerous. It is uncomfortable. If you elevate your legs in the evening, it helps. And you should always tell your doctor about it. Sometimes we just need to change the dose of amlodipine. Some people feel like they are flushed. They feel a warmth in the face or neck. In the first few days of taking amlodipine, that is the vessels dilating from amlodipine, it usually fades on its own from taking amlodipine. Headaches and dizziness can also occur from taking amlodipine, particularly when you stand up quickly. This is called hypotension from amlodipine. Your blood pressure drops momentarily when you change position from taking amlodipine. For seniors taking amlodipine, this is critical. Take your time when taking amlodipine. Sit at the edge of the bed for a second before standing when taking amlodipine. That one simple habit prevents a lot of falls from taking amlodipine. Fatigue is less common but possible from taking amlodipine. A small number of people notice a brief sensation of the heart beating a little faster from taking amlodipine. That is usually harmless early in treatment with amlodipine. Mention it to your doctor regardless when taking amlodipine. Now listen carefully, this is important. The side effects I mentioned earlier are okay to deal with. Some symptoms are not normal, and you need to see a doctor right away. Call for help away if you have severe chest pain that is getting worse. Amlodipine helps with angina. New or worse chest pain while taking this medicine needs to be checked immediately. Don't wait. A fast or irregular heartbeat. Mild palpitations sometimes happen. A pounding, racing, or chaotic rhythm is different. Severe. Fainting. A fall can be bad. For seniors, it can cause a hip fracture or worse. Take it seriously. Or sudden swelling in the face, lips, or throat. This could be an allergic reaction, but it is rare. Yellowing of the skin or eyes. This is rare. It means there is a liver problem that needs to be checked right away. If you are unsure, call your doctor. Don't stay home hoping it will go away when it comes to your heart or blood pressure. You need to pay attention to this, because taking amlodipine is where patients can get into trouble without realizing it. Amlodipine interactions are very important to consider. Grapefruit and grapefruit juice. Grapefruit has things in it that stop a liver enzyme that your body uses to break down amlodipine. What happens is that amlodipine builds up in your body at levels which makes its effects and side effects stronger. My advice is simple. If you are taking amlodipine, do not eat grapefruit. Have an orange instead. Other blood pressure medications include Eufy. A lot of people are taking more than one blood pressure drug. And this is often what their doctor thinks is best. Taking amlodipine with another blood pressure drug or a diuretic can make your blood pressure go down too much. If this happens, you might feel dizzy. You might fall. Let's talk about amlodipine and simvastatin. Amlodipine can make the levels of simvastatin in your blood go up, which can cause muscle pain and, in some cases, a serious condition where your muscles break down. If you are taking simvastatin and your doctor adds amlodipine to your med, this combination needs to be looked at. Your doctor might switch you to a statin. Now talk about certain antifungal medications. Some common medications, including clarithromycin and certain antifungal treatments, can slow down how your body gets rid of amlodipine, which makes it stronger. This is why I tell every patient, every time you see any doctor or pharmacist, tell them about every medication you are taking. Tell them about every one of your medications, including amlodipine. I want to talk to people who are 60 years old or more because amlodipine works really well for people in this age group, but we need to be careful when using it. Never stop taking amlodipine by yourself. This is a mistake that I talked about at the start of this video. I have seen patients who feel better after a week and then decide they do not need the medication anymore. Sometimes they run out of amlodipine and wait a week before getting more. When you stop taking a blood pressure medication, amlodipine, all of a sudden, especially if you have angina, there is a risk that your blood pressure will go up really high. You might get chest pain again. It can be very bad. You should always talk to your doctor before stopping or changing the amount of amlodipine you take. Taking it at the same time every day helps your body keep your blood levels stable. You can take amlodipine in the morning or in the evening. Both times are fine. Some of my patients like to take amlodipine in the evening because if they feel dizzy, they're already at home. Check your blood pressure at home. A home blood pressure cuff is a thing to buy for your health. Take your blood pressure at the time every morning. Before you take amlodipine and after you have been sitting quietly for 5 minutes. Write down the numbers. Bring them with you to every doctor visit. These numbers are more helpful to your doctor than just one reading at the office. Amlodipine is one of the commonly prescribed medicines in the world, and for a very good reason. When taken the way it works well and is good for your heart and blood vessels in the long run. Like any medicine, you need to be careful with it. Know the side effects. Know what is normal and what is not. Keep your doctor updated. Please do not stop taking it without talking to them first. You took the time to watch this. That means you care about your health. That is the attitude. If this helped, you share it with someone who takes amlodipine and may not understand it fully. If you have questions, leave them in the comments. I read all of them. Take care of your heart. See you in next video.